What is stroke? Stroke is now, if I can say in few words, stroke is like our blood vessels, like cerebral vessels. It's a kind of blocked, or the blood is not flowing, and the blood veins and arteries, they are blocked, and that's why uh, that creates some sort of accident. That's why that's the and this what are the symptoms of stroke? Paper, again, take your paper and pen and please write down. ਪਹਿਲਾ ਹੁੰਦਾ ਹੈ ਕਿ ਤੁਹਾਡਾ your face is drooping, and then second is your arm feel very weak, and the S means speech difficulty. Then when you feel like these three symptoms for yourself, or if you see somebody is going through all these symptoms, if anything is happening, then you should right away call 911. That's the time when you call 911, because the weakness is a very important part in this. Because if the weakness is in your arm, on face, if you're feeling sensation, and mostly in your body, like you are sitting with somebody and talking, and you are not understanding what the person is saying, that means you are going through a stroke, or you just sitting there and having this problem. And then if there is a vision, there's your problems with the vision, such as dimness or loss or vision of one or both eyes. Next is like you have a dizziness or problems with the balance or coordination, and problem with your movement or walking, and you were going in one side, but you couldn't walk straight. Or you have suddenly you are feeling unconscious, and the person who is sitting in front of you not understand what's happening to you. And the next is sometimes some people have is a very severe headache. They go through with headache with no known cause, especially if they happen suddenly, that you cannot bear that pain. Or sometimes suddenly nausea, or you feel vomiting and not caused by any viral illness. So sometimes it's like you have your loss of consciousness is very brief and short period of time, and such as fainting and confusion, and it's kind of seizure or confusion, or your hands and feet are not working. So when it's a major stroke, ਜਿਹੜਾ blockage, because of the blockage in blood in your brain, except if you have except that there's too much headache with the, and sometimes if you have seen that people will say, I have a mini stroke, which we can call, we can say the blood supply for a moment or for a short period of time is just obstructed, and then it's called a mini stroke. Mini strokes symptoms are the same exactly as you are having a stroke. Like you have also a difficulty seeing, and you have a change in the vision, and also the change in your coordination and the balance. And sometimes after 10 or 15 minutes, and sometimes it's a half an hour. So it's a short-term mini stroke. It could be few minutes to 24 hours, but sometimes it's an important thing that if you feel that you are going through a mini stroke, you're sitting in the home or seeing somebody going through this, then you should call right away for medical help, because the timing is very important, very important. for the mini stroke. And the definition of the mini stroke is almost the same. We can call it mini stroke. Why it's happening? So whenever the blood flow, our brain flow decreases and it starts blocking. At that time, on which part of the brain started dying, and then it's affecting that area, and it's according to that area, it affects your movements, your speech, or your other activities in your body. You also have heard that two things. Somebody would say that, oh, it was blocked in my brain, but when your blood supply is blood flow is either a thicker or it's obstructed or restricted. Sometimes people have a thicker blood, and that's why sometimes they feel like it might be, sometimes you have a problem in your heart, or your heart is not properly functioning and the blood is not flowing properly because it doesn't go properly flowing into and doesn't go into your brain. And then the other second thing is a brain hemorrhage. Sometimes people have is kind of, if there's some vein or some artery is burst inside the brain, and it's called hemorrhage. And sometimes people don't even figure it out what's happening, because then slowly and slowly, sometimes you don't know how, whether it's a pressure or something, and it busts in the brain, and then it's called hemorrhage. It's very important to separate both things, because the treatment is very crucial. Because for the mini stroke, because you have a headache and suddenly you feel, suddenly you become unconscious, and then you don't figure out your environment outside, that what's going on. The stroke, which is with due to blockage, and you feel weakness in your body. And then I would like to talk about the headache, because sometimes it's not like you are upset and that's why your headache started. Sometimes you have a history of blood pressure in your family, your diabetes, your kidney problem, or these are all the factors, because this plays risk factors in both the strokes. The people who has the veins are blocked in the brain, like you have to maintain high blood pressure. The people who have a heart disease, they have to maintain. You have a heart attack, and then you have to maintain your heart disease. Then it's a diabetes. Diabetes is very much in our South Asian community, and they have more chances to having stroke. Also, the people who are smoking, they also have a problem, high cholesterol level, and we don't even talk about it. It's just a minor thing, but we cannot control cholesterol and lipid level. So if the people who are having a stroke, they think, okay, it doesn't matter, I will be okay, I will be recovered in a couple of hours, So please notice if you have family history matters, because sometimes people who get stroke, sometimes they have a family. That's why the family doctors are ask you about your family history. And the other factor is obesity, because if you are going through obesity, it contributes to stroke. Same, The heart rate, sometimes is cardio structure abnormalities, and your heart rate is then its heart rate is fluctuate, then it also is a kind of a predisposed factor. It also contributes, then it also affects your arteries. You have to, if there is abnormality in your heart from the childhood, then you have to, it could be many types of abnormalities. But listen to your doctor carefully, what the doctor is saying about that. Then also the next is the age. When the person is past age 55 years, and your chance of having a stroke more than double. If it's your high blood pressure, if you're going through diabetes, and you have other ailments, and their chances are double. And there are some risk factors for stroke. Like races, African Americans have, they have a much higher risk. And also it's in our Indo-Canadian community also have a high risk. If because we don't management, we don't pay attention to what's going on, and sometimes it has a stroke is more than in men and less in women. But men are most die for stroke. This is a gender factor. Please note that the risk factors are, if the doctor is asking you that you didn't have a mini stroke before, do you have a history? And if it's a don't consider it just a minor thing. Then also in your hereditary or genetics, the chance of stroke is greater in people with the family history or genetics. Then this part next is the from transitioning from medication acquired overseas or something. We also in our South Asian community every year in September and October go to India and Pakistan. When they go there, when they came back, they have a very difficult. If they have a stroke and they go, and if they should have enough medicine so that they can, while traveling, they have enough medicine, or have if they they have a chronic condition so that they can manage that. Maybe flight can be late. Maybe they have to, instead of going in 24 hours, maybe it will take you 2 days, 3 days, or 7 days. So you have to prepare for that. We have a very common thing that we put the person on the plane and we said, okay, he's fine, that, but remind the person at that time. He must have your contact number, or he must have a number for emergency number, or his doctor's number, so that if he has or airlines, if they have a difficulty during traveling, they can call somebody so that they can get help. They can so that they can survive, if they can know how to get help. If we have to stop the stroke, our theme is we have to manage stroke. There are so many things to prevent stroke, which are the long-term illnesses like diabetes. We have discussed it in many programs, that you check your diabetes regularly, and don't put excuses that I'll do next month or after a month, but do it regularly. Physical checkup must be doing 2 times. It's very important because you will feel or find in that what is the level of your blood pressure, how to maintain your cholesterol, and it's very important to get your eye examination. High blood pressure is because if people have a high blood pressure, sorry, if they have a high cholesterol, then then you will get the idea that you are not managing well. We sometimes say, okay, this is just um, it's a small matter, but it's not small matter. You have to get checked every year, and total cholesterol and your blood pressure and sugar for diabetes, and keeping up sodium, potassium, everything you have to check. It's very crucial so that you can check it, get it checked, and get the results and keep it with you. Because now the BC government has set up a very good program on the internet that you can have your results, yourself, and keep your record with you. Because sometimes you in the family, there's a check for blood pressure checking is sometimes is installed in the senior centers or some other places, but you have to check it at home, because otherwise it's you have to watch your diet, because otherwise but your regular blood pressure, you have to make a list, and so that you can good instruments to check your blood pressure, so that it will be, and it should be appropriate, and that cuff can fit you. So you have to learn how to check your blood pressure. You have to manage yourself. The physical activities are also very crucial, very important. You have to go for a walk for at least half an hour. It's because all the day, if you're sitting down, maybe you can go out and in fresh air and do some exercise so that you can have some strength in your muscles. These things are very important for managing. Physical activities is important. Keep yourself active is very important. Blood pressure, it is also manages your blood pressure, manages your stress level, and then also pay attention to your weight. Maintain your weight. You can keep your weight. Watch your size of your belly, because we were just saying that my weight is all right, but if you look at his size of the belly, it doesn't say, it says otherwise. Also, when your family doctor, you make his specialist appointment for you, follow that appointment and keep it. And whenever your appointment is made, you have the information. And if it's a kidney problem, they can send a specialist. If you have all the clinics, and then follow up all the specialist appointments. Also, whenever, if you have any problem, BC Ministry of Health, they have lots of services they provide, and they have lots of resources, and home care is very important. We will talk about this tomorrow, about after the hospital. Your team explained you, your social worker, your occupation therapist, they all explain to you all the information, how to take self-care and manage yourself. All these programs are in front of you, just to see them, watch them. And the next, what you can do during the COVID, the patients were not coming, they are not coming out. So the patients they were checking their blood pressure at home. And once you keep on checking, and once your sugar is stable, I will see sometimes the people say, okay, I checked 3 times, not time and time again, but just watch your weight. All these things, physical activities, make a file and write down everything. Because when you go to the doctor, say hi to the doctor, and then and then show it, whatever he diagnoses you, ask the doctor to make a copy for you and keep this copy into your file, because it's very crucial, so that doctor will put the form, and then he will come to visit at home, and he will explain to you if you need a wheelchair, what kind of changes you have to make if you are in the wheelchair, and what kind of blood pressure device or what kind of device is going to work good for you. So all the management program will, I think, all these small things will help to manage your health. So please note karo, and thank you all the participants today